It's 9:47 p.m. You're sitting on the couch, and your dog walks over to rest his head on your knee, the way he does every night. But tonight, something feels different. You run your hand along his belly, and it feels tight, rounder than usual, almost drum-like. He shifts uncomfortably, doesn't want to lie down, paces toward the water bowl, then away from it. And that's when the thought hits you. Why does his stomach look like that? You Google it. Within seconds, you're staring at words like emergency, bloat, and can be fatal within hours. Your heart starts pounding. Is this serious? Is this something small? Do you rush to the emergency vet, or do you wait until morning? If you've ever felt that specific kind of fear, the one where you're not sure if you're overreacting or underreacting, you already know how isolating it feels. You love this animal. You'd do anything for them. But a swollen belly can mean a dozen different things, from something as simple as a big dinner to something as dangerous as a true medical emergency. And the internet doesn't make it easier. Half the search results tell you to relax. The other half tell you to run to the ER right now. Somewhere in between all that noise is your dog, quietly uncomfortable, waiting for you to figure out what to do. That gap between not knowing and needing to know is exactly where we're going to meet you today. Big promise. By the end of this video, you'll understand what gas and a bloated belly in dogs can actually mean, how to tell the difference between a minor digestive issue and a true medical emergency, the common mistakes many loving owners make without realizing it, and the simple daily habits veterinarians recommend to help keep your dog's digestive system healthy. You'll also discover a simple kitchen ingredient that costs less than $2, and how using about half a cup in the right situation may help support mild gas and digestive comfort in some dogs, potentially helping you avoid an unnecessary veterinary visit. But first, it's important to understand why your dog has gas in the first place, because the right solution always depends on the real cause. This isn't about diagnosing your dog from a screen. It's about giving you the knowledge to make a confident, informed decision and to know exactly when professional veterinary care simply can't wait. What you'll learn today. Here's where we're headed. First, we'll unpack what's actually happening inside your dog's body when the belly looks swollen. Then, we'll go through the mistakes that even loving, attentive owners make. After that, I'll walk you through the strategy veterinarians actually recommend, including the one warning sign that changes everything. And finally, I'll give you a simple daily routine you can use to catch problems early before they become emergencies. Let's start with the science. Chapter 1. Understanding what's happening. Bloated stomach is a phrase pet owners use to describe a lot of different things, and that's actually part of the confusion. So let's separate them clearly. At the mild end, there's simple gas or gastrointestinal upset, often from eating too fast, a diet change, or a sensitive stomach reacting to something new. The belly might look a little rounder for a few hours, and your dog may seem a bit uncomfortable, but they're usually still acting mostly like themselves. If your dog has only mild gas, meaning they're eating normally, drinking water, acting like themselves, and don't have a swollen, painful abdomen, one simple kitchen ingredient may help support healthy digestion: plain boiled pumpkin. Pumpkin is naturally rich in soluble fiber, which can help regulate digestion and support a healthier balance in the digestive tract. For some dogs, that may mean less gas and more comfortable bowel movements. The key is to keep it plain. No sugar, no butter, no spices, and no seasonings. Just plain cooked pumpkin. Most dogs only need about half a cup mixed into their regular food, depending on their size. It's inexpensive, easy to prepare, and in many cases costs less than $2. Keep in mind, pumpkin isn't a cure for every digestive problem. If your dog's gas continues for more than a day or two, keeps coming back, or is accompanied by vomiting, diarrhea, loss of appetite, a hard swollen belly, or repeated attempts to vomit without bringing anything up, skip the home remedies and contact your veterinarian immediately. Those signs could point to a much more serious condition that needs urgent medical attention. The next few minutes may be the most important part of this video, especially if your dog's belly looks swollen or feels unusually firm. In the middle range, there's fluid buildup or organ-related swelling. This can happen with conditions affecting the liver, heart, or kidneys, where fluid slowly accumulates in the abdomen over days or weeks. This tends to come on gradually, not suddenly. And then there's the one every veterinarian wants pet owners to recognize instantly, a condition called Gastric Dilatation-Volvulus, or GDV, commonly known as bloat. This is when the stomach fills rapidly with gas and, in severe cases, twists on itself. It is a true emergency. It progresses quickly, often within hours, and it primarily affects large, deep-chested breeds like Great Danes, German Shepherds, Standard Poodles, and Weimaraners, though it can occur in other dogs too. Here's what makes GDV different from a simple upset stomach. The belly becomes visibly and rapidly distended, often described as looking like a drum, and your dog may try to vomit or retch, with little or nothing coming up, appear restless and unable to get comfortable, drool excessively, and show signs of distress or a rapid heartbeat. Vet warning. If you notice a rapidly swelling belly combined with unproductive retching, restlessness, or signs of pain, this should be treated as a potential emergency. Contact your veterinarian or the nearest emergency animal hospital immediately. This is not a situation to monitor overnight, but here's what surprises many pet owners. Most cases of a swollen-looking belly are not GDV. They're something far more manageable. Understanding the difference is what allows you to respond with confidence instead of panic. Chapter 2. The mistakes many loving owners make. Many caring pet owners don't realize how a few well-intentioned habits can actually make belly issues more likely or delay them from getting the help they need. Mistake 1. Waiting to see if it gets better. It's completely understandable. Nobody wants to rush to an emergency vet over something minor. But with true bloat, every hour matters. Veterinarians recommend that if the belly is rapidly expanding and your dog seems distressed, you treat it as urgent rather than waiting to see how the night goes. Mistake 2. Feeding one large meal per day. Dogs who eat one big meal quickly are statistically at higher risk for GDV, partly because a large volume of food combined with air swallowed during fast eating can contribute to gastric distension. Mistake 3. Exercising right after meals. Vigorous activity, running, or even excited jumping shortly after a full meal is associated with increased bloat risk in susceptible breeds, likely because movement can encourage the stomach to shift or twist while distended. Mistake 4. Using unsafe home remedies. Some owners have tried things like inducing vomiting, giving over-the-counter anti-gas medications without guidance, or pressing on the abdomen to release the gas. Please don't do this. These approaches aren't proven safe, and in a true GDV situation, they can waste critical time or cause additional harm. Mistake 5. Overlooking subtle early symptoms. Restlessness, pacing, a slightly tucked up abdomen, or reluctance to lie down can appear before the belly looks dramatically swollen. These early cues are often dismissed as just being weird today. None of this means you've done anything wrong. These are habits that seem completely reasonable until you understand the physiology behind them. Now that you do, you're already ahead of where you were 5 minutes ago. Chapter 3. What veterinarians actually recommend. The hero chapter. So here's the part you've been waiting for, what actually helps. First, know the difference between monitor and go now. If your dog's belly looks mildly rounder after a big meal, but they're eating, drinking, playing, and acting normal, this is usually safe to simply watch. If the belly is visibly and rapidly swelling, especially alongside retching, restlessness, drooling, or clear discomfort, this calls for immediate veterinary attention, not a wait-and-see approach. Second, slow down mealtime. For dogs prone to fast eating, veterinarians often recommend slow feeder bowls or puzzle feeders. These physically require your dog to eat more slowly, which reduces both air swallowing and rapid stomach distension. Third, split meals into smaller, more frequent portions. Instead of one large meal, 2 or 3 smaller meals throughout the day put less volume-related stress on the stomach at any one time. Fourth, build in rest time around meals. A general guideline many veterinarians recommend is avoiding vigorous exercise for roughly an hour before and after eating, particularly for large or deep-chested breeds. Fifth, know your dog's individual risk. If you have a large or giant breed dog, especially one with a deep chest, talk to your veterinarian about your dog's individual risk factors. In some cases, for high-risk breeds, veterinarians may discuss a preventive surgical procedure called gastropexy, which secures the stomach in place to prevent twisting. This is a conversation to have directly with your veterinarian, since it depends on your dog's breed, age, and health history. Vet tip. These strategies support prevention for otherwise healthy dogs, but they are not a guarantee against GDV or other causes of abdominal swelling. If you're ever unsure whether what you're seeing is an emergency, it is always safer to call your veterinarian and ask. If you've ever dealt with this kind of scare with your own dog, that moment of not knowing whether to worry, I'd genuinely love to hear about it in the comments. You're far from alone in this. Chapter 4. The science behind why this works. Let's talk about why these habits actually make a physiological difference. Think of your dog's stomach like a balloon attached to 2 flexible tubes, one leading down from the esophagus, one leading out toward the intestines. Normally that balloon stays roughly in place, anchored loosely within the abdomen. When a dog eats very quickly, swallows a lot of air, or fills the stomach with a large volume of food all at once, that balloon expands rapidly. In most dogs, the body handles this just fine. Some gas moves through, digestion proceeds, and the swelling goes down. But in large, deep-chested dogs, there's more room in the abdominal cavity for that balloon to move. Combine a distended stomach with vigorous movement, like running or jumping right after a big meal, and there's a higher chance the stomach can rotate on its own axis, which is what happens in a twist or volvulus. Once that twist occurs, it cuts off blood flow and traps gas inside, and the situation escalates quickly. This is exactly why slower eating, smaller meals, and calm periods around mealtimes aren't just arbitrary rules. They directly reduce the two ingredients most associated with this chain of events: rapid gastric distension and vigorous movement while the stomach is full. Understanding the why is what turns a rule you follow out of fear into a habit you follow with confidence. Chapter 5. Long-term protection. Here's the truth about protecting your dog's digestive health. It's not about one perfect decision, it's about consistency. Dogs who eat at a steady, unhurried pace, who get regular but not immediately post-meal exercise, and who have owners paying attention to subtle changes in behavior. These are the dogs who tend to catch problems early when they're most manageable. Regular veterinary checkups matter here too, even when nothing seems wrong. A veterinarian can assess your dog's individual risk factors, monitor for early signs of organ-related swelling, and help you build a prevention plan tailored to your dog's breed, age, and health history, not a generic one-size-fits-all approach. The Daily Action System, your simple mealtime safety routine. Here's a simple system you can start using today. I call it the 3-check mealtime routine. 1. Before the meal, is your dog calm? Avoid feeding right after high-energy play or excitement. 2. During the meal, is your dog eating at a reasonable pace? If not, a slow feeder bowl can help immediately. 3. After the meal, give roughly an hour of calm, low-activity time before walks, play, or vigorous exercise. Pair this with a quick nightly belly check. A gentle hand along your dog's abdomen while you're already petting them. You're not diagnosing anything. You're simply learning what normal feels like for your dog, so you'll immediately notice if something feels different. Let's bring it all together. A swollen or bloated-looking belly in dogs can range from something as simple as gas after a big meal to something as serious as GDV, a true emergency requiring immediate veterinary care. The key differences are speed and severity. Rapid swelling combined with distress and unproductive retching means it's time to go, not wait. Slower eating, smaller and more frequent meals, calm periods around mealtimes, and knowing your dog's individual risk factors are the foundation of prevention. And a simple nightly routine of awareness can help you catch changes early. You don't have to be a veterinarian to protect your dog. You don't have to get every decision perfect. What you need is exactly what you have right now: attention, love, and a little more understanding than you had 10 minutes ago. Every time you learn something like this, you're becoming a more confident, more capable pet parent. And your dog, even if they can't say it, feels the difference that makes. If you found this kind of veterinarian-approved pet health education helpful, subscribe for new videos every week. Together, we'll help our pets live longer, healthier, happier lives. This video is intended for educational purposes only and is not a substitute for an examination by a licensed veterinarian. If your pet is sick, injured, or experiencing an emergency, contact your veterinarian or the nearest emergency animal hospital immediately.